Good morning everybody. Today my topic of presentation is dry eye after small incision cataract surgery. As we know, dry eye is a significant cause of ocular morbidity and a disease of the tear film and ocular surface which causes ocular discomfort, visual disturbance and the tear film instability. In the phaco era, the manual small incision cataract surgery is still an alternative choice in cases of very high volume surgery done, in cases of dense
Please
cataracts,
speak into the mic.
in case of dense cataracts and in cases of economical inefficient instrumentation needed. Despite of a good cataract surgery, the patient remains still dissatisfied and complain of foreign body sensation, irritation, redness, and blurring of vision, which are considered to be unwanted effect of surgery. Now coming to materials and method, the aim of the study was to evaluate the changes in the tear film following the small incision cataract surgery, and it is a prospective observational study conducted between January 2018 to December 2018 in the Department of Ophthalmology, MKCG Medical College. Total 160 eyes of 121 patients with unilateral or bilateral senile cataracts which were without pre-existing dry were included in the study. Now, exclusion criteria: any ocular pathologies such as pterygium, entropion, and any corneal pathologies were excluded, and then patients having any previous ocular surgeries and known cases of dry eyes were excluded from the study. Now, coming to methods of examinations, all the patients were evaluated for tear meniscus height, tear film breakup time, skimmer test 1, and rose bengal staining on the day before surgery to rule out any pre-existing ocular surface disease. And all patients had undergone an uneventful manual small incision cataract surgery, and post-op antibiotic steroid topical application was used for 1 month. And all post-associates were re-examined for tear meniscus height, T-boot, streamer test 1, and rose bengal staining on the follow-up visits on the day 3 and 1 month and 3 month and 6 month. Now coming to observation results, the male is to female sex distribution ratio was male was 42.5%, female was 57.5%, and age distribution was a 61 to 65 age. It was more common prevalent, that is 41.25%. Now coming to tear meniscus height, it was found low, less than 0.1 mm. In cases of in 1 month cases, that is 30.62%, and it was in 3 month follow up it was 23.75%, and in 6 months it was 16.87%. Now the tear film breakup time with values less than 10 seconds was observed in post-op day 3 on 6.25% cases, and post-op 1 month in 23.1% cases, and 3 months in 7.5% cases, and post 6 months in 1.87% cases. Now streamer test 1 values were observed with values less than 10 millimeter. In post 1 month 5.2% cases, in 3 month 0.62% cases, and 6 month 0.62% cases, and rose bengal stain was found to be positive in cases of post 1 month 21.87%, post 3 month 8.75%, and post 6 months 5% cases. Now coming to discussion, in this study the tear meniscus height values were lowest at 1 month and improved at 3 to 6 months, which were similar to the Ko et al and Ghar et al study. The T-boot values were seen at more at 1 month, and after 3 to 6 months it decreased slight improvement, which is same as Chandan et al, Mohan et al study. And post-operative streamer test values were 5.2, 0.6, 0.62%, which is similar to study shown by Srinivas et al, Kavida et al, and Chandan et al studies. And rose bengal staining was positive and 11.25%, 21.87%, which is similar to the O et al study. Now to conclude, from the above study, it is found that there is presence of dry eye following small incision cataract surgery, mostly at 1 month, and it improves in time. The factors for dry eye after cataract surgeries may be due to the corneal denervation, surface irregularity, decreased mucin production from the conjunctival at the conjunctival incision site, and cautery, and use of antibiotic steroid ointment and steroid drops. So post-operative proper dry management is done if needed to ensure better quality of vision and better quality of life of patients after surgery. These are my references. Thank you.
What was your cutoff value for T-BUT to say it's abnormal?
Sir?
TBUT
Less than 10 seconds. Sir.
Less than 10?
Less than 10 seconds.
So pre-op everybody was more than 10 seconds?
Pre-op everybody
Every single person?
We evaluated for 800 patients, but
800 patients?
But we included only 161 eyes.
So in 161 eyes, not even one was less than 10 seconds?
No, less than not 10 seconds.
Huh?
All were more than 10 seconds. So.
3 of us are cornea specialists. Very difficult to believe that. Anyway, okay.
Thank you.